Today, we're focusing on the side effects of a medication you might have heard about if you or someone you know has an enlarged prostate. Tamsulosin hydrochloride, better known by the brand name Flomax, in the zero point 0.4 milligram capsule. Now, instead of covering everything about the drug, we're going to zero in on side effects. The common ones, the less common ones, the rare but serious ones, and I'll explain why they happen and what to look out for. This way, whether you're a patient, a caregiver, or a medical student, you'll walk away with a clear picture of what's normal, what's manageable, and what's a red flag. All right, quick background. So the side effects make sense. Tamsulosin is an alpha-1A adrenergic receptor blocker. Its main job is to relax the smooth muscle in the prostate and bladder neck so urine can flow more easily. But alpha-1 receptors are also in blood vessels, the iris of the eye, and other parts of the body. So even though tamsulosin is more selective for the prostate than older drugs, it can still cause effects in other places. And that's where side effects come in. Let's start with the most common side effects, the ones doctors see and patients report most often. Number 1, dizziness or lightheadedness. This happens because the drug can slightly lower blood pressure, especially when you stand up quickly. The medical term is orthostatic hypotension. Imagine you've been sitting at your desk, you stand up suddenly, and the blood in your body rushes toward your legs before your blood vessels tighten up to push it back up to your brain. With tamsulosin, those vessels relax more than usual, so the response is slower and you feel lightheaded. Number 2, runny or stuffy nose. Sounds unrelated, but alpha-1 receptors are also in nasal blood vessels. When they're blocked, the vessels dilate and you get nasal congestion. Some people feel like they have mild allergies while on the medication. Number 3, ejaculatory changes. This is one of the hallmark side effects of tamsulosin and can take patients by surprise. Because the drug relaxes muscles at the bladder neck, semen can go backward into the bladder instead of out through the urethra. This is called retrograde ejaculation. It's harmless physically, but it can be worrying if you weren't expecting it. Sometimes ejaculation volume just seems reduced. Number 4, fatigue. A general sense of being more tired than usual, likely related to the blood pressure effects and the fact that the nervous system is slightly more relaxed. Now let's get into the less common side effects. These happen in a smaller percentage of people but are still worth knowing. Headache, probably due to blood vessel changes. Back pain, not directly dangerous but something patients sometimes notice after starting. Diarrhea, mild gastrointestinal upset can happen with any oral medication. Itchy skin or mild rash, a sign of sensitivity, though most cases are mild. Then there are the rare but serious side effects that need urgent medical attention. First is severe allergic reaction, swelling of the face, lips, tongue, or throat, difficulty breathing, severe rash, or itching all over. That's a medical emergency. Second, priapism, a painful erection lasting more than 4 hours. It's extremely rare, but if it happens, you need immediate treatment to avoid permanent damage. Third, very low blood pressure, not just mild dizziness, but fainting or feeling like you might pass out even at rest. And fourth, Intraoperative Floppy Iris Syndrome, or IFIS. This is something that can happen during cataract surgery. The iris becomes floppy and more difficult for the surgeon to manage. It's not something you'll notice at home, but if you've ever taken tamsulosin, even if you stopped months before, you need to tell your eye surgeon. It can change how they perform the surgery. Why am I telling you all of this? Because knowing side effects ahead of time makes them far less scary if they happen, and it also helps you recognize the ones you should never ignore. Let's talk about when side effects usually happen. Most of the common ones, dizziness, nasal stuffiness, tiredness, tend to appear in the first few days or weeks, especially after the first dose or a dose increase. Many people notice they fade over time as the body adjusts, but retrograde ejaculation can be persistent while you're on the medication. Rare effects can occur at any time, which is why staying alert matters even months into treatment. All right, quick pause here. If you're finding this breakdown useful so far, do me a favor and tap that like button and subscribe so you can catch more videos where we explain meds and conditions in plain English. Back to safety. One tip to reduce dizziness. Take the first dose at night right before bed and always stand up slowly from sitting or lying down. For nasal stuffiness, a saline spray can help. But avoid decongestants without checking with your doctor because they can counteract the drug's effect on the prostate. And if you notice ejaculation changes, remember it's reversible. Things return to normal after stopping the medication. One last point, drug interactions can increase the risk of side effects. Medications that strongly block liver enzymes, CYP3A4 or CYP2, D6, like ketoconazole or paroxetine, can raise tamsulosin levels and make dizziness or low blood pressure more likely. Always keep your medication list updated with your healthcare provider. Now, for my medical and nursing students, here's a quick mnemonic for remembering the key side effects. Drop it. D for dizziness from low blood pressure, R for runny or stuffy nose, O for orthostatic hypotension, P for problems with ejaculation, retrograde or reduced volume, I for iris syndrome during cataract surgery, T for tiredness or fatigue. So to wrap up, Tamsulosin. 0.4 milligram capsules are generally well tolerated, but side effects can range from mild and temporary, like dizziness or nasal congestion, to rare but serious issues like allergic reactions or eye surgery complications. Most can be managed or avoided with awareness and good communication with your doctor. Knowing what to expect means you can get the benefits of easier urination without being caught off guard by the downsides. All right, that's it for today. Thanks for watching. Take care, and I'll see you in the next one.